Good day, I'm Lorraine Mendez and this is your JIS News for Friday, June 3. Government will be spending $100 million to ramp up its mosquito prevention and Zika control activities in light of increased cases locally. At a press briefing yesterday, Health Minister Dr. Christopher Tufton revealed that up to May 29, there were 16 confirmed Zika cases in the country. But he warned that the number could be much higher given the high volume of suspected cases and the fact that most infected persons may not show symptoms.
Only 1 out of 4 of the infected persons will have symptoms, and of the persons who are ill, only about 1 in 1,000 may have severe symptoms.
As part of the ministry's second phase of Zika prevention activities, 1,000 workers will be employed to support the public health teams as they conduct island-wide community vector control and public education activities. And in addition to regular fogging and larvicidal activities, the ministry will be conducting heightened house-to-house surveillance in sections of the population where the infection has been notified and/or confirmed. The ministry's intervention will also target the proper use of the 45 to 55-gallon water drums, which have been identified as being among the main breeding sites for the Aedes aegypti mosquito.
Through the charitable services of Food for the Poor, we have had dialogue with them. We are in the process of ordering some 50,000 drum covers. It's a mesh that would secure water in those drums. We may need a couple 100,000. We're going to start with 50,000, but we're also going to be dialoguing with local manufacturers to see to what extent we can encourage the production of this particular item and making it available in the hardware stores and so on for persons to go and acquire on their own.
Meanwhile, the Health Ministry is also heightening its intervention to protect the well-being of pregnant women and their babies. 2 pregnant women are among the confirmed Zika cases. The Health Minister says they and other pregnant women will be continuously monitored throughout their pregnancy.
As you know, the unborn child is at high risk of developing microcephaly once the woman has been infected with Zika virus while pregnant. As part of the second phase of our activities, we'll be placing more emphasis on pregnant women, their partners, and those who develop severe diseases such as GBS.
20,000 bed nets will be provided over 6 months to all pregnant women who visit government antenatal clinics. Dr. Tufton has also assured that the ministry has stocked adequate supplies of the requisite medication to appropriately treat all forms of Zika manifestation, adding that supplies will be monitored and more bought as necessary. The Health Minister will be making a statement in Parliament next Tuesday to provide further update on the matter. Still on health, Prime Minister Andrew Holness has asserted that government will maintain the no user fee policy at public hospitals. He says the Minister of Health is working on a program that will allow persons to contribute to a health insurance scheme, which will help to cover those persons who are in need of health care but are unable to afford the associated costs.
Every Jamaican should be able to access the healthcare system at the time of need freely. And that is what is meant by our no user fee policy. It doesn't mean that at some other point you don't pay. But when you need it, the issue of your being able to afford it should not come up.
Prime Minister Holness was speaking in an interview with JIS TV. He said a contributory insurance scheme to provide universal health care was endorsed by the World Health Organization. In other news, the Prime Minister says government remains committed to the goal of renewable energy providing 30% of Jamaica's energy needs by the year 2030. Mr. Holness says he expects the renewable sector to expand to meet the demand for electricity as the economy grows. The Prime Minister was speaking on Thursday as he commissioned into service Phase 3 of the WIGTON wind farm in Rose Hill, Manchester.
By virtue of this investment, the approval of investments in solar technology, the implementation of LNG, which will come into our fuel mix in short order, and what we are about to do with waste energy, and the explorations for hydro and other biofuels and carbon-based fuels, we will have probably the most diversified energy mix in the region.
The 24-megawatt expansion is projected to generate just over 63,000 megawatt-hours of electricity annually for supply to the national grid. It's expected to save the country over $230 million annually and reduce oil consumption by 37,000 barrels per year. The facility began supplying energy in March by way of 12 2-megawatt wind turbines, a 9.6-kilometer transmission line, and a new substation. And finally, Jamaica's unemployment rate dropped to 13.3% in January 2016 as an additional 31,400 persons were employed since the same period last year. Director General of the Planning Institute of Jamaica, Colin Bullock, revealed the data from Statin's labor force survey during a media briefing earlier this week. He said the total number of employed persons as at January 2016 stood at 1,163,600, 1 percentage point lower than the rate recorded in January 2015. There was also an increase in the labor force by 21,500 persons, with 11 of the 16 industry groups recording higher employment levels.
The largest increases in employment levels were recorded in wholesale and retail trade, up by 14,200 persons, construction, up by 9,800 persons, hotels and restaurants up by 6,500 persons, and other community, social and personal service activities up by 6,500 persons.
And that's it for JIS News today. I'm Lorraine Mendez. Thanks for watching.